Hello and welcome to our video on anesthetic considerations for patients with a history of thyroid disease. Thyroid disease is a common condition that affects many people, and when combined with the need for anesthesia during a surgical procedure, there are several important considerations that must be taken into account. In this video, we will discuss the challenges of managing anesthesia in patients with a history of thyroid disease and the best practices for preoperative assessment, perioperative management, and postoperative recovery. Preoperative assessment. Before any surgical procedure, a thorough preoperative assessment of the patient's thyroid condition is crucial. This includes evaluating the patient's thyroid function, such as measuring their thyroid hormone levels and assessing the presence of any nodules or tumors. It is important to identify any potential complications that may arise during the surgical procedure, such as the risk of thyroid storm in patients with hyperthyroidism or the potential for airway compression in patients with large thyroid nodules. Perioperative management. During the surgical procedure, it is essential to monitor the patient's thyroid function while minimizing the risk of complications. This may involve a combination of pharmacological and non-pharmacological approaches, such as the use of beta blockers to control heart rate and blood pressure in patients with hyperthyroidism, or careful positioning to avoid compressing the trachea or recurrent laryngeal nerves in patients with thyroid nodules. Postoperative recovery. After the surgical procedure, the management of thyroid disease continues to be an important consideration. The goal is to optimize thyroid function while avoiding the risk of complications. This may involve the use of thyroid hormone replacement therapy, monitoring of thyroid hormone levels, and careful monitoring for signs of complications such as bleeding or infection. Conclusion. In conclusion, managing anesthesia in patients with a history of thyroid disease can be challenging, but with proper preoperative assessment, perioperative management, and postoperative recovery, patients can receive safe and effective anesthesia while managing their thyroid disease. We hope that you found this video informative and helpful. Thanks for watching.